From MTN News, this is Montana This Morning.
I'm Mike Dennison in Helena. So, whatever happened to that $112 million in federal COVID relief money for childcare in Montana? Coming up, I'll tell you.
Employees stretched too thin and patients not receiving the care that they need. I'll tell you what's going on at the Montana State Hospital coming up.
All right, 6:30 on this Friday. Chet Lehman, Matt Elwell with you here. We're racing towards the weekend.
Thinking about dinner, we were just talking about dinner.
Just talking about cast iron Dutch ovens and meatloaf in this case.
Yeah, well, and meatloaf has a lot of meaning today.
There we go.
Yeah.
We just put it all out there,
That's
don't we?
right.
All right, Matt, weird weather this morning. I'm going to use weird. I don't know if that's a weather term.
I use the term bipolar.
There you go.
It should be polar. I don't know. It's cold. That wind is a little chilly when it kicks up, but it's not bad. A couple of snowflakes here and there. Watching for black ice. Temperatures are definitely cold enough that we see that. We do have some active snow in parts of the area. Some accidents reported on Bozeman Pass early this morning. I think they've been cleared up, but watch for black ice and slick conditions. It's been windy. So Homestake Pass, scattered ice, and look at that snow flying down the Gallatin Canyon. You're going to have some delays if you're driving between Bozeman and Big Sky today, but the positive is it's snow, and if you're going to go skiing, you're in luck. Temperatures holding right into the 30s. That wind just kicked up. Likely to be dealing with warmer and more pleasant conditions as you head into the afternoon. We're going to break down your complete forecast in just a few minutes.
All right, thank you, Matt. 6:32 now. The COVID-19 relief bill passed by Democrats in Congress last March had $110 million to bolster childcare in Montana. But as of this week, Gianforte administration has yet to distribute any of the money to childcare providers, although hundreds have applied for it. TN's Mike Dennison tells us what's happening.
Last fall, the Gianforte administration committed $31 million of this federal money for childcare stabilization grants to help providers across the state. When more than 400 providers applied, the administration decided it should add another $30 million to the pot, and 2 weeks ago, a legislative commission endorsed that request. State Public Health and Human Services Director Adam Meyer said grants would total 45% of a child care provider's operating expenses for 2022, but only after subtracting the amount of COVID relief money they got the previous 2 years. The state also says it's still reviewing applications and that initial payments should go out in the coming weeks. Some child care providers are not happy with the state. At the commission meeting 2 weeks ago, Elizabeth Schultz of Learn and Play Childcare in Belgrade said grant information and amounts as told by the state have been constantly shifting.
What was told to us with so much excitement and enthusiasm has led to nothing but disappointment and a complete loss of trust in the DPHHS.
4 Republican lawmakers on the commission voted against spending the additional $30 million, including Representative Terry Moore of Billings.
I just am troubled that there are virtually no priorities about how these funds are dispersed. And it's just simply, for all practical purposes, based on an allocation of expenses and not, frankly, on where is the highest, best needs for the best outcomes in Montana.
The commission chair, State Representative Frank Garner of Kalispell, also a Republican, said there must be clear expectations on how the child care money goes out, but he provided the swing vote to endorse the increase.
I think it is so critical, such a critical need right now, that I don't want to delay the ability for us to get this money out into the field.
I also talked to Valerie Reigard, the director at Just Like Home Daycare in Helena. She said once Just Like Home finally gets its grant, she may use it to benefit their staff, such as covering more health insurance costs or contributing to their retirement funds. Across the state, child care providers say hiring and retaining staff is their biggest concern and a primary reason why Montana faces an ongoing shortage in affordable child care. And the other $40+ million in the COVID relief bill for Montana child care? The Gianforte administration says it's working on a plan to spend that money to help child care providers bolster and sustain their businesses. Reporting from Helena, Mike Dennison, MTN News.
The Montana State Hospital in Warm Springs is facing allegations of employee abuse and facing the consequences of a patient death that could have been prevented. For months, the Montana State Hospital has been facing a severe staffing shortage and investigations into employee and patient treatment.
You know, I've lived in Anaconda for 27 years and I know a lot of the employees out there, and I've been hearing for, probably over 2 years about problems that just keep getting worse and worse.
A Centers for Medicare and Medicaid Services report, which was released last September, detailed the death of a patient. An excerpt from the CMS report found that last August, a patient had gone to nursing staff to complain about being short of breath. Nursing staff told her to return to your room and stop being dramatic. 45 minutes later, the patient was found dead. During the investigation, a nurse admitted that the death could have been prevented, saying, "We were very short-staffed that day." The investigation found that the facility failed to thoroughly investigate the unexpected death to show that neglect did not occur. Currently, 40% of the 524 staff positions within the hospital are vacant. State Senator Mark Sweeney says there will be a public hearing at the state capitol where a panel will discuss the problems facing the facility.
It's beyond time for the state of Montana to look into this and see what's going down and really drill down into the lack of management.
The meeting to discuss the issues plaguing the Montana State Hospital will be held January 21st at 1:30 p.m. The public is welcome to attend in person or online through Zoom. In Warm Springs, Caitlin Aguilez, MTN News.
All right, 6:36. Doctors and public health leaders are sounding the alarm about significant increase in pregnant women getting infected with COVID. Asher Karashi found the warning comes as new data emphasizes the increased risk of severe complications.
As a clinical coordinator in women's health,
hey, did you get my teams?
Alyssa Thies spent much of her time over the last 2 years working with COVID patients.
I'd say on an average day, we can have anywhere from 2 to 3 that could be COVID positive.
Pregnant with her first child and having underlying asthma, she masked attentively and made sure she was fully vaccinated and boosted. But as the Omicron surge was taking hold just before Christmas, Thies got infected.
I definitely had that kind of sheer panic. Like, okay, I'm sick. How can I make sure that I get through this and make sure I get through my child through this?
There is reason for concern. Last week, a population-wide study published out of Scotland reported that premature births, stillbirths, and newborn deaths are more common among women who get COVID 28 days or less before their delivery date. At Prentice Women's Hospital in Chicago, 13,000 babies are born each year, making it one of the largest birthing centers in the country. Here, coronavirus cases among pregnant women are spiking.
Now, more than ever, we are seeing a surge in pregnant and birthing persons who are positive for COVID-19, more so than any time during this pandemic.
Dr. Melissa Simon is a Northwestern medicine obstetrician gynecologist at Prentice. She says about half of the pregnant patients they are seeing are unvaccinated.
You used to keep COVID patients separate from non-COVID patients, right?
Yes, there's just too many. It's 1 in 4 to 1 in 5 patients are COVID positive right now, and we just don't have enough rooms for that.
According to the CDC, as of January 8th, just over 42% of pregnant people aged 18 to 49 were fully vaccinated before or during their pregnancy, compared with 67% of the general population over the age of 5. For pregnant people who are Black, the figure falls to only 26%. The message from physicians and public health agencies for pregnant people is clear.
Right now, it's so important to get boosted or to get the vaccine if you haven't. It is completely safe in pregnancy. It's completely safe in lactation, and it will help mitigate your chances of getting hospitalized or admitted to the intensive care unit with potentially terrible outcomes for you and your baby.
Alyssa Thies, who is 38 weeks pregnant, says her bout with COVID included congestion, a bad cough, and extreme fatigue. But she credits the vaccine for getting her through it without severe complications.
Had I not been vaccinated, I could have been in an ICU. I could have been ventilated. That is kind of what sits in the back of my head, is it could have been much worse.
I'm Asher Qureshi reporting.
All right, 6:39, time for a break.